Thank you. It is, like others have expressed, an honor to be here, but for me it is a bittersweet honor. On March 2nd of 2016, this year, less than 3 months ago, the second oldest of my 5 daughters died of an opioid addiction overdose. She was an extraordinary young lady. She had dreams for the future. She was an athlete training for her first marathon. She was witty and smart. But her story is the story that parents all over our country and all over the world have experienced. I speak today, therefore, not as a public official, but yet as a father, as a parent. I speak on behalf of those who have lost loved ones, as well as those who fear the loss of loved ones. They fear that call in the middle of the night. It is a call that we received and will never forget. But let me tell you a little bit about what happened in the tragic circumstances of my daughter Jessie's death. When she was a young lady, graduated high school with great ideals and great hopes, she went to college. In her first semester in college, she was the victim of a rape, a sexual abuse. It changed her forever. She kept this within. She didn't tell anyone. She simply told us she wanted to come home after her first semester because she was homesick. We believed her. We missed her too. When she came home, feeling a sense of shame, a sense of guilt, undeservedly so, she was looking for something to relieve her pain. A friend introduced her to heroin, and it changed her life. For 7 years, she struggled with this addiction. She fought hard. She went through periods where she was sober for 2 years and then would relapse. In August of last year, in her bedroom on the 3rd floor of our house, she overdosed and almost died. When we found her, she was essentially dead. And in fact, my wife, Kate, administered CPR. The paramedics came and administered naloxone, which saved her life. And it sent a message to her that she wanted to live. She did not want to be an addict. And so she recommitted herself to sobriety and was doing great. She had been sober for 7 months when she sustained, pursuant to her marathon training regimen, a running injury, a bacterial infection that required surgery. And so she went to the hospital. The doctors were informed of her addiction history, that she was a prior IV drug user. Despite the medical records reflecting this fact 8 times, when she was discharged 8 days after her surgery, or 6 days after her surgery, but after being in the hospital 8 days, the attending physician did what he always did for a 30-year-old, seemingly healthy, post-surgery patient. He gave her 50 oxycodone. Even though she was committed to sobriety, you have to understand the addict brain. She could not resist that temptation, and she died that night. What we have been doing is trying to find ways to make sure that this does not happen again. There has to be greater communication. There has to be greater coordination within medical institutions. And so in both the United States Senate and the U.S. House of Representatives, legislation has been introduced, which has been called Jessie's Law, which will, I think, have a positive impact. She was a person who was committed to, like many of you here, social change, positive social change. She wanted to be a part of the process. And although she has not been able to be a part of the process in her life, we hope that in her death she will be. And so this legislation will simply do one thing. It will require that addiction history is prominently displayed in all medical records, so that the discharging physician, the attending physician, the treating physicians, the specialist will all know and will take actions accordingly. This is something that we feel very strongly about, Madam Secretary, and we believe that these types of things are critical. It is so important to end the stigma, as you mentioned in your remarks. It's so important that addicts be treated as sufferers of a disease. It is so important that we have treatment centers that use effective treatment methodologies. And it's so critical that once people are committed to recovery and committed to sobriety, that they, in fact, are not put in at-risk positions again in the future, and that people are aware of their situation and how fragile they are and how they need to be handled with care. We can't treat it as business as usual. So on behalf of parents everywhere, on behalf of my family, my 4 surviving daughters, I urge this body to continue its work on these important issues. Thank you.